Good afternoon and welcome to Families USA's monthly Health Action webinar. This month we're focusing on oral health issues as part of our monthly series of webinars that we're producing for the Health Action Network. We appreciate everyone joining us today. I'm Patrick Willard, the Senior Director of State and National Strategic Partnerships here at Families USA, and I'm happy to welcome you to this conference on Oral Health for All, addressing dental coverage for grown-ups in Congress and the states. Today we will be recording this conversation and making the slides available for folks afterwards. Also, they can be shared with anyone that you would want to share the slides and the information and recording with. In order to participate in today's webinar, we'd ask that if you have questions, when you think of those questions, go ahead and type them into the chat box so we know what questions you have, what questions are out there, and then we'll respond to the questions at the end of each of the major sections. And we'll be having 3 different sections as we go through today's webinar. So you'll have the chance to go ahead and type those questions in, and we'll be able to answer those questions that way. I'll be serving as the moderator for today's webinar. Joining me will be Melissa Burroughs, who is our Oral Health Campaign Manager. She'll be discussing the Oral Health campaign here at Families USA. And then on adding oral health as a benefit, we will have Amber Christ of Justice in Aging. She'll be talking about the current efforts to add a dental benefit for Medicare. Then on the Medicaid side, improving Medicaid dental coverage, we'll have Kathy Kilrain Del Rio, who is with the Maine Equal Justice Partners, and we'll be talking about some of the work that they've been doing there in Maine to improve the adult dental care benefit under their Medicaid program. And then we will have the opportunity for further questions from everyone. So again, feel free to type your questions into the chat box. We'll look at those questions and be able to answer them as we go through the webinar. Obviously, oral health has been an issue for many years, but it has recently become more apparent the problems in terms of adult coverage for oral health, particularly in a recent data release that came from CDC, which showed that, and confirmed what we've known from previous data, that less than a third of adults 65 and older have dental insurance, and that's a problem in terms of the Medicare side of the equation. That data also showed that 2/3 of those older adults have had a visit to the dentist within the last year. But there's a breakdown in disparities within the numbers there between those who are not poor and those who are poor, and also between different ethnic groups. All this is important in terms of the Medicare conversation because Medicare for All has arisen as an issue around the country, particularly around the upcoming presidential elections. And as people focus on Medicare as a program that provides health care coverage for seniors and the popularity of that program, people need to be aware that there are gaps within that coverage, and one of the major gaps that we're seeing out there is oral health, which is not covered under the Medicare. It's also a problem for those poor populations that are under Medicaid, and because there is a wide variety of differences in the way states provide their adult dental coverage under Medicaid, the types of services that people are able to access is very different. And this is obviously for vulnerable and critical populations. So to take us through some of this and Families USA's own campaign around oral health for all, I'm going to turn it over now to Melissa Burroughs. Melissa.
Thanks, Patrick. So as Patrick said, oral health is one of the critical issues that we are working on here at Families USA because oral health is such a major gap in health insurance programs, and also because those gaps have resulted in enormous health needs for vulnerable populations. And so Families USA has a multifaceted ongoing campaign to expand oral health coverage for all through adding oral health coverage to Medicare, improving Medicaid coverage for adults, and in general, raising the profile of oral health as an important healthcare issue and an important social justice issue. So, as a little bit of background for those of you that are new to oral health and why it might matter to you as a healthcare advocate, oral health really is all connected to overall health, to health equity, and to social justice. Oral health is connected to our ability to work, our ability to eat, our ability to play, our ability to go to school. There's plenty of studies that show those with poor oral health have difficulty engaging in those activities. And in terms of health outcomes, oral health is also connected to many other health conditions, including diabetes, stroke, heart disease, pregnancy outcomes, even Alzheimer's. And so when we have these gaps in care, these gaps in coverage, and these gaps in health, that really has a huge and disparate impact on populations that are not able to get care. So that is why we're here talking to you about oral health today, and we're excited to be working with you on this issue. Patrick covered a little bit of this, but just as a reminder, in terms of public coverage of oral health, Medicare excludes oral health coverage, which means that the large majority of seniors do not have any oral health coverage. This is also true for many people with disabilities, although there isn't clean-cut data on that, and that also that most states do not provide meaningful, comprehensive Medicaid oral health coverage for adults. While we've made a lot of progress for children, adults, whether they be people with disabilities, whether they be older adults on Medicaid, whether they be pregnant women, or whether they be Medicaid expansion, ACA Medicaid expansion adults, it varies widely state to state, and most states do not provide coverage for those groups, or they may provide different coverage for each of those groups. So to give you a little bit more about the landscape in each of those spaces, there has been gaining momentum in Congress around Medicare oral health coverage. We've got a long way to go in terms of building even more momentum around this issue, and we hope that you all will join us in that effort. But luckily, we have started to see a number of bills getting introduced and champions arising in both the House and Senate around the need for oral health coverage in Medicare. So there are several of these bills now that would introduce oral health coverage along with vision and hearing care into the Medicare program. There are several of these bills that would just specifically focus on dental coverage. And then there is one bill that would look both at adding these services to Medicare as well as increasing reimbursement to the state for providing dental, vision, and hearing benefits in Medicaid for adults. And these are all good starts and good ways to start talking about this issue and making sure we raise the profile of this issue. But in the current political climate, it's not likely that these bills are going to move anytime soon. So, we urge all of you to keep talking about this issue and making sure that people are paying attention. When time comes, we can really lift up some of these ideas and how important they are to improving people's health and people's lives. In terms of Medicaid in the current landscape around adult dental, we see a wide variation in what adult dental coverage looks like across the country, and also within a state what it looks like for various adult populations, as we mentioned, and as you can see here. Luckily, there are a number of states that are working on this. It's been a constant fight for many oral health advocates in many of these states for years and years. But this year we have seen some progress in a number of states, whether it's something as small as improving reimbursement rates for what coverage does exist. That is, a piece on an incremental step along the way, and we've seen something like that pass in Kansas this year. We're going to hear later from Kathy in Maine, who will tell us more details about how they are moving forward with adult dental coverage in their legislative session, although it's not through the gate yet. And then we've also seen states that are looking at adult coverage just for specific populations. So for example, in Utah, they passed a bill this year that looks at or adds adult dental coverage for just the elderly population, which again, these are all small steps, but we are excited to see legislatures paying attention to this issue and starting to take action and, again, building momentum around the importance of this issue. So to learn a little bit more about what Families USA is doing, I will give you a high-level overview, and I also encourage you to check out a number of these resources that I'm going to mention. And we're hoping that you all will join us in this effort in a number of ways. But in broad strokes, what we're doing is we are pulling stakeholders together, including our Health Action Network, as well as national partners and the Oral Health Progress and Equity Network, to inform the policy conversations we're having and inform a lot of the feedback we're giving to members of Congress on some of these bills and on what our priorities are around oral health in Medicare, and also to be able to provide technical assistance to various folks in states working on adult dental coverage. And we're also working on coalition building as well, making sure we have a real strong base of folks that are willing to speak up on these issues and prioritize them in their agendas. So we really have been encouraged by the amount of support that we've gotten from a lot of you so far, and we hope that many more of you will join us down the road. As I've sort of alluded to with the Medicaid adult dental work, there is a lot of activity happening at both the state and local level to raise the profile of these issues, and we have been offering some technical assistance, and we've also been facilitating a group called the Medicaid Adult Dental Benefit Learning Collaborative that we encourage you all to join if this is an issue you're working on, where advocates can learn from each other on how to best move these issues forward. We are raising policymaker awareness, both here in DC and out in the States, and we've been working with a number of you to do that together, and we will continue to provide tools to make that as easy as possible. And then finally, we've been doing a lot of work around story collection and storytelling. Our storytelling work, we have a new story collection website called oralhealthforall.org, which can be shared at events, in clinics, in waiting rooms, at charity care events, that will serve as a place for folks who are experiencing oral health problems, who are experiencing a lack of coverage, who really are facing a lot of these challenges we alluded to in the beginning, to share their story and get involved in this campaign if they would like. So if that is something that you're interested in disseminating, please do. And you will be hearing from us throughout the campaign of just how this affects real people and how this is such an important issue for us all. Other ways that Families is working on raising the issue in a more immediate sense. First is on a smaller effort related to Medicare dental coverage. This is an administrative effort with the CMS and the Health and Human Services Agency to get Medicare to cover what is called medically necessary dental coverage, and this would allow a really narrow interpretation of what Medicare could cover for people that need oral health care that is integral to another Medicare-covered procedure. So if you need your gum disease taken care of in order to get a kidney transplant. And Amber will be telling us a little bit more about that. The other thing we can do in a more immediate sense is making sure, as Patrick alluded to, that we are engaging in the universal coverage conversations that are happening. Things like Medicare for All, and making sure that oral health is part of those conversations. There will also be upcoming elections, and we encourage you all to continue to collect and share stories as well. To elaborate a little bit more on the universal coverage and oral health connection, I won't go too in detail on any of the specific policies, but I did want to highlight a Signon Opportunity that you all are welcome to join in on. There is an open letter, which there's a link to in these slides, that will be open until June 11th, that lays out why it is so important that any proposal looking at universal coverage includes a conversation around oral health and is sure to address oral health. The letter lays out how current programs, including Medicare, including Medicaid, and also the ACA, fall short for people's oral health needs, and that it encourages policymakers to be sure that they are considering these critical issues as they develop their proposals. So if you're interested in signing on, we'll send out the link. Quickly, I'm going to go through a couple more tools for engaging. First, on Medicare, certainly you can reach out to Families USA, our partners at Justice and Aging, who will be speaking shortly. We're also working closely with the Center for Medicare Advocacy. And as I alluded to, there is a number of folks at a national coalition working on this, and we'll be formalizing that coalition and producing more resources soon. In the immediate, you can work and sharing stories and collecting stories and making sure that this issue is getting attention. You can also sign on to the Universal Coverage Options Letter. And then coming soon, there are a couple of resources that we wanted to make sure you all are aware of. First of all, within the next month or so, we'll be launching an Action for Medicare Dental learning advocates who want to get involved in the Medicare dental effort to learn from each other, to make sure they're up to date on the latest developments in Congress, and to make sure we're thinking together to develop the best strategies that will elevate this issue and make sure that we move it forward in the next couple of years. We also have two other resources coming up soon, including fact sheets on the Medicare issue that are for each state, as well as a toolkit for how to raise these issues around universal coverage and Medicare for All and oral health, and we'll be releasing that for August recess, so you can talk to your policymakers at that time. In the Medicaid space, you have another set of wonderful national partners. You're welcome to reach out to us. The Children's Dental Health Project, Community Catalyst, and Justice and Aging also work on these issues. And these other resources I've mentioned include story collection, the Universal Coverage Options Letter, and there's the Medicaid Adult Dental Benefit Learning Collaborative, which is existing, and we encourage you to join if you're interested.
So, thank you for that, Melissa. We have the resources listed here that will be included in the material that we'll be sending out. Again, I will remind people to, if you have questions, to type your questions in the chat box. We'll be getting to some of those questions later on as part of the webinar. But at this point, I'm going to turn things over to Amber with Justice and Aging to talk about adding a dental benefit in Medicare and the various ways that people are approaching that. So Amber, take it away.
Thanks so much. So my name is Amber Christ. I am the Directing Health Team Attorney here at Justice and Aging, and my pronouns are she, her, and hers. And I'm going to drill down a little bit on adding the dental benefit to Medicare that Melissa touched on. So next slide. I always like to start off a little bit about Medicare Basics. I think a lot of us are really seeped in Medicaid, but not as much in Medicare. So Medicare is a federal program. It is available to individuals who are 65 and over who have a sufficient amount of work history, and then individuals who are younger, who are under 65, who have had a disability for 2 years. The Medicare program is not free, nor is it comprehensive, and so some major things are left out of the Medicare program, most notably in this instance dental, but also vision and hearing, which have been mentioned, and long-term services and support. So it is not a comprehensive program, and there are some pretty major benefits missing for older adults. As I noted here, there's no dental coverage except some really small minor exceptions that are linked to some chronic diseases. Next slide. So it's pretty critical to add a dental benefit to Medicare. Melissa mentioned how dental care is integral to our overall health, and that's particularly true for older adults who are more likely to have chronic conditions. So you have diabetes and heart disease. You're more likely to get aspiration pneumonia in a nursing home if you have untreated gum disease and at high risk for infection. So a lot of reasons why getting and having access to oral health is important for older adults. Yet we know that 65% of Medicare beneficiaries have no dental coverage. That means that 37 million individuals in the United States do not have coverage as older adults. And as a result, nearly 50% did not visit a dentist in the last year. And there are incredible disparities based on race and income and disability that I have listed here. Just for an example, individuals who have income below $10,000 are 70% with those income levels they don't have health insurance, did not have a dental visit in the last year versus 27% that have incomes up to $40,000. So we're seeing huge disparities, and a Medicare benefit could really help to even the playing field here in that everybody who has Medicare coverage would have access to those benefits. The biggest barrier to coverage is cost, which is not surprising. The other big deal here with adding a Medicare dental benefit and having access for everyone is the fact that it could be added to Medicare in a really comprehensive way. So if you go to the next slide, we are talking about adding the benefit to the Part B benefit. So that would really act to integrate oral health into the overall medical benefit. So just a little background on Medicare. Medicare has Part A, which is the hospital coverage, and then Part B is the outpatient kind of coverage. So if you go to the doctor or you're going to a specialist, anything that you would receive outpatient is in the Part B benefit. So the idea is to add the dental benefit right into the existing Medicare Part B benefit. So then it would be treated the same way as all other health services in the Medicare program. What's also really great about putting it in the Part B benefit is that it's then just integrated into healthcare overall. As we know right now, oral healthcare is very siloed off from the rest of our healthcare delivery. When was the last time you went to your medical provider and they really checked out your teeth and made sure that your dental health was okay? And how often is your dental provider talking to your medical provider? Probably hardly ever, if at all. So this would work to kind of integrate oral health into the medical delivery system, which would be a game changer. Additionally, adding the Medicare or the dental benefit to Medicare Part B would go into the same kind of payment structure that's in place for Part B, which is 80% is what Medicare pays, and then there's 20% coinsurance. And then with preventative services, there's no coinsurance. So, your annual dental visit or your annual dental cleaning would be a preventative service that you'd pay no coinsurance on. And then the provider payments would be adjusted by region and subject to annual stakeholder comment, just like any other services under Part B. So we're really talking about making this a comprehensive dental benefit based on medical necessity and payments made to providers, looking very much like we see in the Medicare program today. Additionally, the same low-income protections that individuals who are in the Medicare program currently receive would also apply to the dental benefit. So it would help to pay for out-of-pocket costs. So we have the Medicare savings programs that help pay for the Part B premium, the QIM-B program that helps pay for cost sharing, so that you would really see that low-income individuals would have zero cost sharing, for example, just like they do for other medical services that they receive under Part B. Next slide. So a question we get a lot is, well, why can't we just do this in Medicare Advantage? So Medicare Advantage are these private Medicare plans that you can join. You have the option to join. And some of them provide supplemental dental services. Unfortunately, most of those that offer these supplemental dental, they're not comprehensive types of services, and they're high cost sharing. So a lot of them are pretty skimpy coverage and does not go nearly far enough to provide comprehensive coverage. So if we were to add Medicare or dental benefit to Medicare Part B, all Medicare Advantage plans would have to provide that benefit because Medicare Advantage plans are required to provide the same Part A and Part B benefits that are in original Medicare. So all Medicare Advantage plans would then have to provide the comprehensive dental benefit rather than their own supplemental. Of course, they could go above and beyond the comprehensive dental benefit if there were things that they wanted to cover beyond that. But if it were added to Part B, then all Medicare Advantage plans would have to provide that. So that would really provide a much more comprehensive benefit and get beyond what we see in Medicare Advantage today, which is really limited set of benefits with limited scope of services and high annual or low annual caps on the amount of benefits you can receive. Next slide. So then the question becomes, what about Medicaid? And Melissa touched on this, that the coverage for dental services for adults is an optional benefit under the Medicaid program. And as a consequence, we see wide variation across the states with regard to how comprehensive their Medicaid dental benefits are. So we have 19 states that we would contend have extensive Medicaid dental coverage, yet still not, entirely comprehensive. Still, limitations on scope, like you can only get a crown every 3 years. Not really tied to like it's medically necessary, so you're entitled to it, kind of comprehensive coverage, but still, extensive relatively. And then we have 18 states that offer limited benefits and 15 states that offer no benefits beyond emergency services. So really huge variation there, and few states really offering comprehensive services. What would happen if a Medicare benefit a dental benefit got added to Medicare is that we would really see that all of those individuals who are on Medicare would have a comprehensive benefit, and then Medicaid, and it would be a uniform benefit across all the United States, and it would also provide some stability there in the event that the benefit would go away. So this would act as the primary benefit. The Medicare benefit would act as the primary benefit for individuals who are dually eligible for Medicare and Medicaid. So it would be really great for all individuals, including individuals on Medicaid. Next slide. So Melissa touched on this. There's been some significant legislative efforts to move this forward. First of all, just as a preliminary matter, in order to add a dental benefit to Medicare, we actually have to change the statutory language, because right now in law there is a specific exclusion for dental services under Medicare. So we would have to remove that exclusion and then add definitions to the statutory language. And we have a report that we put out that is on a slide that's coming up that discusses what exact legislative changes would need to occur in order to add a dental benefit to Medicare. And Melissa also mentioned some of the legislation that's already been put forth this year. So we're really excited to see so much happening. So we have the Medicare Dental Benefit Act by Senator Cardin that has a companion House bill, HR 2951. There's also the Medicare Dental Vision and Hearing Benefit Act of 2019, the Seniors Have Eyes, Ears, and Teeth Act, and the Medicare and Medicaid Dental Vision and Hearing Benefit Act of 2019. And Melissa also had on her slide that there's some forthcoming legislation that we're anticipating from Sanders and Representative Neal. So we've got a lot of momentum here, which is super exciting to see this. I wanted to point out Senator Casey's bill is also really interesting because it not only adds a dental benefit to Medicare, but also has language in it to encourage states to increase their dental benefit under the Medicaid program by increasing the federal match to states. So some really exciting legislation, but obviously a long way to go in order to make that legislation real. And I think your stories are so incredibly important. So as Melissa mentioned, there's a lot of ways to get engaged, and one of them is really by providing stories that we can use and building the momentum around adding a dental benefit. A lot of older adults don't realize that when they come off their employer coverage and they go into Medicare, that Medicare doesn't even cover dental. So they're completely surprised by that. And then even when they get coverage, the few percentage that do receive coverage, that coverage is rarely comprehensive and it has high out-of-pocket costs. So we still see a lot of gaps, even for those individuals who have coverage. So all of those stories are really important. And that website, Oral Health for All, that Melissa mentioned, is a great place to start, for us to start collecting those stories so that we can tell those stories to our legislators and also the media, and really build this momentum around the legislative effort. Next slide. Melissa also mentioned the medically necessary dental advocacy that is going on. And as she noted, this is a kind of small way of adding some dental coverage under the Medicare program. So this is really administrative advocacy, not as much legislative. We're really working with the Centers for Medicare and Medicaid Services and the Health and Human Services agencies to expand the scope of when Medicare can pay for dental services that are integral to an underlying medical condition or procedure. So we think that CMS already has the authority to do this and that they're just interpreting their own rules in a way that's too narrow. So we want them to expand their interpretation to include coverage in medically necessary situations. So to give an example, you have an individual who is in a car accident in which the jaw was broken and several teeth were lost. You go into the hospital, you have all of this work done, including reconstruction of the jaw, but Medicare is now refusing to pay for the extractions of teeth that were necessary and the crowns to save the teeth that had been damaged. We're saying that no, that those extractions and those crowns should be covered by Medicare because it's really integral to the underlying medical condition or procedure that was taking place. So it is narrow, but it is a really important way to expand coverage for people to which the situation applies. So there's a lot of advocacy going around on this, and Families USA and all of us have been trying to engage folks in this. So over 115 organizations have signed on to a community statement for CMS to change interpretation of the policy. So if you haven't done that, please get in contact with us or Families USA or the Center for Medicare Advocacy, any of us, and we will make sure that you get added to that community statement. And then last fall, we engaged in a campaign to get House and Senate members to sign letters to send to CMS, again, contending that they should expand the policy. And then there have been some meetings with HHS and CMS to change the policy. So we might be, again, reaching out to folks in order to gain support if the opportunity presents itself. But right now we're kind of in these meetings trying to convince HHS and CMS to change this policy. And then finally on this last slide, I have put some additional resources, including that recent study that came out of the Kaiser Family Foundation that I cited to earlier in the presentation regarding who has Medicare or who has coverage as a Medicare beneficiary. The second bullet is our statutory analysis about adding an oral health benefit in Medicare. There's a white paper that a whole bunch of us put out last summer about adding a dental benefit to Medicare. And then Families USA has put out a really great resource describing why oral health care is particularly important for rural seniors. And with that, I will turn it back over.
Thanks so much, Amber. So we've heard a lot now about what's going on from national organizations trying to frame the conversation around an oral health benefit. But obviously the work that is going on in the states is critical here. And in terms of getting those Medicaid benefits, that's where the rubber's hitting the road in terms of raising the awareness. Obviously, any national effort that we're going to do is going to have to have that sort of grassroots, state-based effort to raise the awareness with members of Congress and with others, policymakers, about the importance of oral health so that we can continue to make this a broader national issue. But to tell us a little bit about how it feels to do some of that grassroots work and the progress that they're making in Maine, we've got Kathy Kilrain Del Rio with Maine Equal Justice Partners to talk about what's been going on up there in Maine during this legislative session. So Kathy, I'll turn it over to you.
Thank you. And we actually just recently changed our name to just Maine Equal Justice. And you can go on to the next slide. So we come to this work as an organization that's part of the legal aid community, and we were formed back in the 90s when legal aid providers were no longer able to do a lot of systemic advocacy. And we work to increase economic security, opportunity, and equity for people here in Maine. We focus on a variety of anti-poverty programs and solutions to help people move out of poverty, including Maine Care, which is our Medicaid program, TANF, SNAP, general assistance. And we do that in a couple of different ways. So we have direct legal services. People call us all the time, every day, asking for help, often dealing with our Department of Health and Human Services and accessing programs, but also with other issues around municipalities and general assistance or other areas where people have opportunities to access programs that can help them with poverty issues. We also do a lot of work with the immigrant community here in Maine, so some of our issues are not quite as obviously connected to poverty, but are more about immigrant rights. We do organizing work where we partner directly with people who have experienced poverty or are currently experiencing it now and help them figure out how to be the best advocates for themselves, both through our direct legal services work, like with programs, but then also at the legislature or with the department. And that's a big part of our work these days. And then we also do systemic advocacy at the legislature and with some administrative advocacy. And we do a little bit at the federal level, particularly around SNAP and then healthcare access in general. And so we came to this issue really because of our healthcare work. Many of you know that we've spent here in Maine, we spent 8 years with Governor Paul LePage as our governor. He was very anti-poor people and did a lot of things that were really harmful for our state, including refusing to expand Medicaid under the Affordable Care Act. And we had 5 legislative efforts to expand Medicaid here in our state, and that took up a lot of bandwidth here and a lot of the healthcare conversation for many years. Then we took it to the ballot. We have a ballot initiative process here in the state and had people sign to get it on the ballot. We had very successful, one of the highest voting passages of a ballot initiative in our state in order to expand Medicaid. Even after that was in 2017. Even after that, Governor LePage continued last year to refuse to implement the law. So our organization was really the lead in helping people figure out what were the next steps. We sued the administration. We worked to help people figure out how to go ahead and apply anyway, so that when it finally was implemented, they would have retroactive coverage going back to July 2nd of last year. And then we also tied it to the election. We are nonpartisan, but we did make sure people understood that who you vote for has an effect on your ability to access health care. And as a result, next slide, we successfully elected someone, Governor Janet Mills, who ran on a healthcare platform. And the first picture here shows her signing her first executive order, which was to implement Medicaid expansion. And this ties to our dental work in a second. And then her very first cabinet appointment was Commissioner Jean Lambrou for our Department of Health and Human Services. And some of you may know that Jean was very active in the ACA effort in the Obama administration and has a lot of healthcare background. And so we were really excited to see someone with that focus leading our state's largest department and the department that we interact with the most. So it was wonderful. Medicaid expansion has been a huge boon to our state. We already have more than 21,000 people who have been enrolled since January 1st. Many of them are people who applied. Over 6,000 of them applied when Governor LePage was still refusing to implement the law. But the whole expansion conversation really shifted the way people thought about Medicaid in our state, and also became sort of like the centerpiece of the fact that health care is necessary for everyone, regardless of your background and regardless of your income, and that everybody should have access to the full range of health care that they really need. Next slide. So as we were talking after the election, as we were talking with our advocates who are part of our Equal Justice Partner Circle, many of whom are in this picture, we, in the fall following the election, we started talking about, like, so what can we do with a better governor to really, what's the next step for healthcare? What is it that you all feel we need? And we also had an electronic survey that we sent out to people in our network. And we also had a lot of information from our own direct contact with people on the phones to know that dental care was really like the thing a lot of people were begging for. Next slide. And so we decided to put in a bill that was it turned out to be LD 1453 that would create a comprehensive dental benefit in our Maine Care program that's diagnostic, preventive, restorative care, including full and partial dentures. These were all things that we heard, and we weren't willing to settle for less. Like, we really feel it's important that it be comprehensive. And we sort of have nicknamed this our Make Maine Smile campaign, and have used that as a hashtag a lot during this effort. Next slide. And our sponsor that we recruited to help us is someone who's been, this was actually when Representative Drew Gatine from Westbrook, Maine, he received an award from us a few years ago. He's been a real champion for people in poverty for a long time, and he is our House Chair of the Appropriations Committee, and we knew that part of this fight was going to come down to being able to have the money for it. So we thought it was really important to have someone who wouldn't only be a great advocate just in terms of passing a bill, but who also would really fight to make sure it got funded. And I messed up this slide. There was actually several pictures here that showed our Equal Justice Partner Circle people working. But early in the legislative session, our Equal Justice Partner Circle came together to talk with legislators such as these, and to also do some brainstorming. And first they learned a lot about just how the legislative process works for those who are new to it. And then they broke up into groups based on their areas of interest. We had several priorities that came out of that group of individuals, and this was probably the one that had the most energy behind it, along with an administrative effort to really rebuild and make better our Department of Health and Human Services. And so there was just so much energy in the room around dental every single time it came up. And I will say this was true every time it's come up in any setting that I've been in this year. People clap, they cheer, they join, they say something about the importance of dental, because they recognize that this is like a thing that is vitally important for people's health care, for people's well-being, for people's ability to get a job, so much. Next slide. So we put in LD 1453, what became LD 1453. There was actually another bill that we had found out about really early in the legislative session, LD 230. It was a bill that another Democratic legislator who's been in the legislature for a really long time and also serves on the Appropriations Committee had put in on behalf of Northeast Delta Dental. It also would create a comprehensive dental benefit. What's printed, if you look it up online, is just a concept draft, but we saw a draft of what their intent for the bill was, and they wanted to also do a comprehensive dental benefit, but they wanted to do it within a managed care carve-out. So to talk a little bit about the benefit specifically, ours was pretty straightforward. You need to create this comprehensive benefit. We did not dictate how it should be implemented. Maine is one of the few states that doesn't have managed care in our Medicaid program, maybe the only state that doesn't have any managed care. And we at Maine Equal Justice have been leery of managed care for a really long time for a lot of different reasons. But early in this legislative session, the folks at Delta Dental came to us and said, like, we want to talk with you and we want to talk with your partners about why we think a managed care carve-out might be the way to go. And so we had several very candid meetings with a group of us from a couple of different oral health coalitions, one just Maine Oral Health and one focused on children, with dentists, with other healthcare partners who do a lot of advocacy for low-income people, with the FQHCs, talking about like what Delta Dental wanted to do, and they wanted to do it with DentaQuest, and also us talking about what we wanted and what was important to us. And some of the things that were really like bottom lines for us is that we recognized that people had a lot of pent-up need. We didn't want to do anything that would hinder their access to the care that they need. We thought it was really important to at least come into this process without any caps. I know a lot of states do have caps on care, but we really felt like we didn't want to dictate that. And to just keep our options open. We didn't want to put the new administration in a position where they felt they had to do a managed care carve-out if that wasn't the right thing in their minds. We wanted to do what's best for people to access care. On the other hand, Delta Dental made a really strong case, and I think some of you have heard us talk about this before in the network calls, that Maine has the lowest participation rate of dentists in Medicaid in the country. And so access is a huge issue, particularly in rural parts of the state, but really everywhere. And, Delta Dental has like over 80% of the dentists in their network here in Maine. And so having them, if they were to successfully get the contract through an RFP process, help us with implementing this benefit, it could really help with access. So we were really open to that conversation, but also didn't want to just assume that that was the best route. Next slide. So early on in the session, this got a lot of attention, right? Even before we had said anything about it, some news outlets picked up on this and talked with our sponsor and did some really great articles. And then later, as we got closer to the hearing on our bill, we got some good press as well. The two bills probably should have been heard on the same day, but for a variety of reasons, LD 230 ended up getting heard very early in the session. It had about 12 or 13 people testify, mostly organizations, including us. We testified in support, but with cautious interest in the managed care piece. And then when our bill had its hearing in April, we had actually over 40 people testify, 48 individuals submitted written testimony. Over 50 people testify, I mean. Many of them, like nearly 30, were people who were directly impacted by not having access to dental care. 6 or 7 were dentists, providers, but lots of other partner organizations and healthcare proponents as well. So there was a lot of energy around this, and the press definitely picked up on it. And we really do think this is the next step for healthcare access in our state. Next slide. So we started right at the beginning of the session trying to put out some social media around this, and we were collecting stories. So our Equal Justice Partner Circle had a working group that was specifically focused on dental care. One of our organizers was very focused on this. Another part-time organizer who's from our Equal Justice Partner Circle went to a couple of locations to have meetings with people who are going to food pantries or child care centers or people who are homeless and hear their experiences without having access to dental, so that we had like a real snapshot of like the many, many consequences of not having dental care, and also like that those all have costs as well. And we've recently found out that our state's already spending over $2 million a year providing this emergency dental benefit that is not consistently used, that isn't the best way to manage people's dental oral health, right? So it's already a huge cost to us to do what we're doing. We should do this in a way that's smarter and giving people preventive care and access. So we did a lot of focus on like what helps. In the next couple of slides, you go ahead and forward, you can see some of the statistics that we shared with people through social media. And it was really great. These were very popular, and people really, these are kind of the messages we also used. And I'm not going to play this right now, but when you get the slides, you can, I think, make this work so it plays a video, an audio file, but also you can go to that link and see it on our Facebook page. But this was a story of a young person who had dental care until he became an adult and then lost it. Because he gets his health care through Maine Care, and how his oral health has really deteriorated very quickly. He's still very young and has a lot of issues now. And the next slide as well is another woman who talks about the consequences of not having access to care. And then we also, of course, did things like trying to get letters to the editor printed, and all those things that you all probably do in your lives all the time. Next slide. And what ended up eventually happening was LD 230 was voted unanimously in committee ought not to pass. The committee did not want to dictate that it be a managed care carve-out, and so that bill is now dead. And LD 1453, our bill, received a unanimous ought to pass. I did right, as amended vote. And the amendment that they did was basically, we had a piece in our bill that said we'll set aside $1 million to use as an incentive to encourage providers to take new Maine Care patients. And there would be a working group that would figure out how to do that incentive. And they took that out, the incentive and the working group. But the basic comprehensive benefit was still, which is the most important part, was stayed in. We were so excited. And I'll just say, our emergency benefit was put into place in 1989. My colleague Chris Hassett, who still works here, was there, helped make that happen. And it's taken us 30 years to get to a place where where the stars were aligned and the energy was there, and partners from both the people who are directly affected as well as providers and other healthcare people recognized the value of this and said, we are going to make sure that people have access to this. So it's taken a long time, and I think the message of the last 5 or 6 years, specifically around expansion and the national conversation around universal health care, have really pushed the envelope around what people's expectations are for health care, and that's how we got to this place. So next slide. We were super excited about the fact that we got this unanimous vote. We actually weren't expecting a unanimous vote. We didn't know that we were going to get it. So that was really exciting because there's a couple of conservative legislators on that committee that we didn't know we would have. And in further conversation after the fact, we realized that the one that probably was the linchpin of getting us that vote, she had a personal experience with someone in her family who couldn't afford dental care, and the consequences of that made her really know just how important this is. So what's happening right now is we're towards the end of our legislative session. Statutory adjournment is June 19th. Our bill is actually still in committee right at the moment. It's likely to come out any day now. Our fiscal note that they originally had put in place, which was way overestimated, it was a range of like $9 to $19 million, was ridiculous, has been reduced based on data that we helped found. We worked with the person who does the fiscal note to talk to them about things that they should keep in mind. And we expect that fiscal note is going to get reduced down to about $6 million in the second year of the biennium. We actually probably won't have a cost in the first year of the biennium because the bill is going to further get amended during this process to not go into effect until July 1st of next year for a variety of reasons that we think are for the best to give time for proper implementation. So right now we're kind of waiting to see. We have hopes that it might get into the budget, but our budget process, like I'm sure all of yours, is really complicated, and we don't know if that's going to work out. We are hopeful. We know our sponsor clearly cares about this, and he's chair of the Appropriations Committee, so that will hopefully help. If it doesn't make it into the budget, then the bill will move forward. We expect to get good, strong votes in both the House and Senate if that happens. And then it will go to the appropriations table where, again, our sponsor will do his best to try to find funding. And we're doing everything we can to help him with that. And so that's where we are. But I think just from everybody who's been working on this issue far longer than I, and for all the people who are directly affected, like this feels like the moment. And this is when it has to happen for our state. And we are so excited that we think this is really possible. And I think that's all I have.
Great. Well, thanks so much, Kathy. I think that's a great overview of how to made a difference there on the ground in Maine, and raising the visibility of the issue and also the importance of the issue. And I think having all those stories and even legislators coming up with stories is a critical piece to making this happen. We started a little bit after the hour, so we're going to try and hit a few questions here before we wrap up, and we might run a little bit over at that time. But one question, I think, for Melissa and Amber, one question that has come up is Congress about a dental benefit in Medicare, and those members of Congress who have raised concerns about dentistry and the need to move to value-based reimbursement model as part of any support that they would give to a Medicare benefit. And that raises the question of where is the ADA in these conversations about a Medicare benefit. And so Melissa and then Amber, why don't you take that?
Sure. So, we've been hearing the same thing from a number of members of Congress about their desire to see value-based reimbursement in dentistry or related to a Medicare dental benefit. And, that's sort of a challenging line that we're getting because that's not something that would be determined in legislation. That's something that would be determined in rulemaking afterwards, and that would, be sort of a after-the-fact step. So the fact that that's the line that we're getting from members of Congress is a little bit frustrating, but it is also something that as an oral health community we should be thinking about. I know a lot of folks out there are trying to think about how dentistry could be reimbursed differently in order to better promote outcomes and to move away from a fee-for-service model, but it's certainly well behind the medical field in getting there. So I think as progress is being made in that arena, it's important to keep members of Congress abreast of those activities, but also remind them that we can't really change the system if there's no payment mechanism in place at all. I think in terms of the ADA, the American Dental Association, they are divided on a lot of things, and the two issues of Medicare coverage for oral health and changes in payment models are certainly going to be two that are very divisive. In terms of Medicare, many of the ADA's members are supportive of adding a Medicare dental benefit, but the people within the councils and the internal structures have not come to agreement in support, but they certainly aren't coming out in opposition or anything like that. So I think, we're all continuing to work with them. We know that many of them are bought into this process, and that we just need to craft a policy that would support providers in taking these patients, and so we're certainly glad to continue working with them as this moves forward. And we'll just have to see. I don't know, Amber, if there's anything else you wanted to add there.
No, you did a really great job summarizing. I will say, just on the value-based payment stuff, that I totally agree that first the goal is to get the benefit in place, and then the way that providers are paid is sort of something that happens through regulatory guidance. And who's to say that 15 years down the road we don't come up with some other type of payment model that works better? We've been testing all of these different payment models, so that's a step we take later. The first kind of concrete step is making sure we get the benefit added, and then we can move towards a system that is really incentivizing outcomes. So totally agree with that, and your analysis on the American Dental Association.
So there was a question about emergency services under Medicaid and what's considered an emergency service. Kathy or Amber, do you want to try that? What are the emergency services now in Maine?
It's very hazy, because the way that benefit, the way it's written now and the way it's implemented, it has, there's like several things. It has to deal with pain, tooth loss, impact. If they think that the cost of fixing whatever the problem is will be less than whatever the long-term consequences of letting it go unchecked are. So a lot of dentists don't even know what they can actually get covered or not. And on the other hand, there are some that really know how to kind of work the system and get people care that they might not otherwise get. So we've talked with people who have had all their teeth pulled, and it's not necessarily covered, but they had to have them pulled because of the pain. And other people where they were able to get better access to something than that. So it's very inconsistently implemented right at the moment.
This is Amber. I'll just add that there's federally required adult dental services, or what we call the FRADs, and those are always covered benefits. So those are the things that you could a doctor can perform. So usually those are, extractions are the big one. So those typically fall within that bucket in Medicaid programs that have to be covered. And then I think there's so much state variation, as was just noted, that the way that other emergency services come in. But the FRADs are federally mandated, are federally required adult dental services that must be covered.
Great, thanks. One question, Kathy, about the data source that you were using for those preventive dental and the lowered cost for chronic diseases. So what was the data source for that?
Yeah, so we have an organization called Maine Health Data Organization, and Delta Dental actually paid over $20,000, I believe, to get emergency department usage and other code, to get what's covered, and they also used our Freedom of Information Act to get some data from the department to figure out what's actually currently being spent in Maine and what's currently, what are the claims currently, and that's the data that we were able to use, which was why it was we would never have been able to afford to have gotten that data. So that was one of the places where having a partnership with them was really helpful.
Thanks. Melissa, is there any other sort of national source that states could use?
I don't know if this is something you looked at in putting together the slide on lowered costs due to chronic disease in other states that have preventive dental services, Kathy, but the National Association of Dental Plans released a set of data about a year ago showing just how much states could save when they on chronic disease expenditures for various different chronic diseases, and so that could be used for anyone, and we can send that link to that data source out after the meeting.
Yeah, and we did look at that. I mean, partly it's what our person who does the person who's working on the fiscal note will actually accept as like data that they trust enough to believe it can be used to decide the fiscal note. So that's kind of its own complicated process. So that's why having the Maine specific data in raw format was really helpful.
Thanks. So we're past the hour, and I know we still have some additional questions, but I want to respect people's time. I appreciate everyone joining us for today's conversation. Obviously, oral health is a major issue across the country. We've seen in polling that 89% of the population supports adding a dental to Medicare, and this is support that's across both party lines, demographics, and incomes. And so we know this is a popular issue. We also know that it's an issue that still needs to be raised so that we can raise the awareness of policymakers about the benefits of this issue and about the needs of it. And so at Families USA, we want to continue to focus on this as a consumer movement to make sure that people are taking up the value of oral health coverage and understanding the connection of oral health to overall health and the benefits of overall health by bringing in better and more comprehensive oral health coverage. So we'll continue to do that. And we appreciate you joining us for this webinar. We'll be, as I said, we've been recording this webinar and we'll be making it available as well as the resource material that's referenced in the webinar itself. So thank you for joining us today, and look for another Health Action webinar in the months to come. Thank you.